Hey, this is Doug Field along with my co-host Ron Bachman, and welcome back to the final segment of Healthcare Consumerism Radio. And, this market has a lot of different moving parts, and benefit programs are changing and evolving, and we've got the baby boomers emerging, Ron, like you and I. And join us to talk about a very important niche, hearing benefits, is Mike Reha, the Director of Sales Marketing with Epic Hearing. Mike, good morning.
Hey, good morning, Doug.
How are you?
I am doing well. How about yourself?
Doing fantastic. You coming to us from out in California?
Southern California.
Yeah, great to have you here. I guess we're in Better Hearing Month. Is that correct? Is that when May is?
We are. This is a big month for the manufacturers as well as the providers to initially launched hearing care benefits and the reason why people should go and get their hearing checked.
Yeah. Talk to us a little bit more about what Epic is doing and about the hearing benefit, because actually I have a personal interest too. That's where my wife wants me to go get my hearing checked.
That's your selective hearing loss, Doug.
No, but in all seriousness,
go
ahead.
In this industry, it's really changed in the last 2 decades. Hearing loss is starting to occur much younger in people. Part of it is the technology that is surrounded us. We call them the iPod generation. That the analysis shows that the majority of people with hearing loss are below retirement age. So 57% of Americans that do have serviceable hearing loss, they're the candidates for hearing instruments and accessories. And for the majority of these individuals, only 20% actually get treated. And part of the reason for that, it's not a covered benefit.
Mike, Ron Bachman here. I really think this is an important area, and I'm glad to have you on the program here because as I read through some of the background for Epic, you really want to get out there and educate the public. It seems to me that especially the younger generation, with loud music and concerts blaring, headphones, the earbuds, we do have a lot of hearing loss out there, and it's got to affect people on the jobs, not just their spouse or their significant other not hearing or understanding them. We like to kid about that sometimes with our so-called selective hearing loss of our spouses. But this is a real important area. Talk to us a little bit about, from your perspective, the issue and the significance of hearing loss in the workplace.
Yes, we did a survey among 1,500 full-time workers, which we conducted right at the end of 2013, and the study suggested that 12% of employees say they have diagnosed problems for which they're getting treatment for, but another 30% suspect they do have hearing problems, but they have not sought treatment. And of these, almost all, 95%, reported that the untreated hearing loss was impacted them on the jobs. And so people are concerned about going and getting their hearing treated. There is still a stigma attached with hearing aids, unlike some of the other specialty care benefits. People still associate hearing loss with aging, and they don't want to admit the problem to their employers that they have a problem, because if they go to their employers and tell them that they have a hearing problem, the likelihood is that the employer will view them differently than somebody that doesn't have a hearing issue.
Mm-hmm. Well, you've got some publications that you use out there for public education. There's something called Listen Here. Can you tell us a little bit about that publication and how successful and widespread that is right now?
Yes, we just launched this new campaign yesterday called Listen Here. It's on our website, www.epichearing.com, and it's a public education initiative with a video infographics that employers can share with their employees and integrate into their existing health education. Again, our goal or objective is to get employers and employees to consider hearing benefits similar to how they are offered in a marketplace, similar to what vision and dental is offered.
Right now, even if you're not covered for some of these areas under your traditional benefit plan, one of the interests we have here, obviously, at the Institute for Healthcare Consumerism is the account-based plans. These benefits can be paid under HSAs, the health savings accounts, health reimbursement arrangements, and people can set aside FSA dollars for that. Is that correct?
Yes.
Again,
is there an opportunity, Mike, dental and vision, have a wellness connection? I think you pointed out with hearing benefit, the wellness and productivity connection. Is there an opportunity for you to look at more bundling with dental vision?
Yes, there's a lot of opportunities by bundling this product with other ancillary products. First of all, with vision and dental, depending on how you offer it in the marketplace, whether it's employer or employee paid, the likelihood is if you offer it to 10 employees, you're going to get 5 to 6 of those individuals using a benefit. With hearing, if you offer it to 10 employees, the likelihood is you're going to get 1 out of every 10. And the reason for that is that when you have hearing loss, you don't just wake up one day and say, I'm going to go see a hearing care provider. You adjust your lifestyle. Statistically speaking, in our industry, by the time somebody admits they have a problem to the time they go see a provider, on average is 7 years. And generally during those 7 years, what individuals do is they actually change their lifestyle by perhaps increasing the volume on a TV or radio, or in a lot of cases, if they're having a conversation with somebody, they actually have to ask that person to repeat themselves over and over again. And generally, when somebody does go and gets their hearing treated or checked, it's usually a spouse or family, another family member or friend that encourages them to go get their hearing checked.
So tell us about your business model. Who are you selling to? What's your marketplace out there? Is this a product you're selling to employers? Is it available to individuals? Is it mainly through an insurance concept? What's your business model?
Sure. Our business model is that we're marketing this to a lot of different types of segments. First of all, we're marketing this to employers, employees to consider hearing benefits. We're marketing this to other managed care organizations to consider hearing for their membership. We work with Taft-Hartley funds. We work with association and groups. We offer this product on a group platform, which can be offered either as a standalone product or it can be combined with other ancillary products. In the near future, we are coming out with individual as well as small group products.
Yeah, Mike, I would think that you would have a unique opportunity with the emerging private exchanges as they take their place in the marketplace. One of the key drivers of a successful private exchange is going to be offering an expanded voluntary benefit supplemental health offering. Are you working with any private exchanges right now, or is it still too early for you?
It's still a little early in its infancy when it comes to exchanges, but there's been quite a few exchanges that have come and expressed interest as far as a second go-around to consider some of these ancillary benefits. And one of these types of benefits is hearing, because currently right now most major medical plans do not cover any products when it comes to hearing loss. And for 90% of hearing loss, the only accommodation is hearing instruments.
Yeah. Mike, coming back to May being, Better Hearing Month, what would you at Epic like our audience, what would you like them to know and do during this crucial month where you're trying to get the word out?
What's very crucial is to go out and start talking to your clients about hearing benefits. Through some of the initiatives that we're doing, we can provide the education support as well as the video support for groups or individuals to consider hearing benefits. This is a unique benefit that it's never been offered this way, and we're just trying to get people to get engaged in the fact that it's time to consider these type of benefits, and that hearing is not just for old age anymore, that statistically speaking, that the majority of people with hearing loss are below retirement age. So this is something that groups and individuals need to consider in the workplace, that hearing is becoming much more prevalent in today's line of work than it may have been maybe 20 years ago.
Can you talk to us a little bit about the new technologies that might be available? I know when I went and had my hearing tested, they said, I couldn't hear a certain range, and that was sort of a natural aging process. But for people who have more significant hearing loss, we hear so much about technology improving so many other parts of our healthcare delivery system. Tell us about hearing aids and or other ways to improve hearing. What's available out there for people?
Well, generally right now, for the majority of people with hearing loss, the only accommodation is hearing aids, and hearing aids have become quite sophisticated probably in the last 2 decades. I've been in this industry now for a little over 25 years, and when I first got in this industry, it was all analog products. And today's market, most of the manufacturers are manufacturing digital technology, which means they can separate speech from noise. They can work in a variety of different types of environments. They even have cell phone capacity where if somebody uses their cell phone, They're able to use these devices, and so they work in a lot of different variety of situations, and they've almost become smart hearing instruments.
Mm-hmm. Well, what about prevention? Are there things that you suggest or recommend, or are there services that people should be doing in terms of whether it's eardrops or some other care that we should be doing with our ears that we're not doing today that could help prevent the problems in the future?
Yeah, what we're encouraging people to do is to get their hearing checked regularly, just like they get their vision and dental checked. And so, for example, in your 20s and your 30s, every decade you should be getting your hearing checked. So if you have any threshold changes, at least you know what you're exposing your ears to, whether it's at work or your lifestyle, and what you can do to protect your ears. Especially when you go into loud environments, the number one recommendation is to wear ear protectors. And a lot of people don't do that. So we're in the stage where a lot of baby boomers have went to rock concerts and they come out with their ears muffled, and part of the reason for that is that they're not wearing hearing protection. Yeah. And so we suggest that people wear hearing protection in loud environments, and that when they get into their 40s, just as their vision acuities decrease, they should get their hearing checked on a regular basis. That's just, and then when they get a little older in life, get them checked on a regular basis every 2 to 3 years.
Mike, we've got about 30 seconds to go. Would you give our audience one or two takeaways? We really appreciate you being with us.
Yes, I think the number one thing to consider is hearing benefits for your groups, and that hearing insurance can be very inexpensive, and there's a lot of opportunities to offer this type of coverage to your members, whether it's through fully insured, self-funded, or discount-type plan offerings. That hearing is starting to become much more prevalent among the workplace, and this is something that you have an opportunity to go out and talk to your groups about a new opportunity and new benefit, which is relatively inexpensive to offer.
Hey, Mike, well, listen, I appreciate you joining us. You have a great weekend. I look forward to talking to you again soon.
I appreciate your time, and have a good weekend yourself.
Thank you. And to our audience, this wraps up to this week's segment. We'll be off next week, busy at IHC Forum here in Atlanta next week, and we'll join you the following week on Healthcare Consumerism Radio.